and disregard the pain that circulates your body. This is your reality. A world where you lay on the cold, hard pavement, wishing of a lifestyle that has the luxury of healthcare. Every individual deserves the right to a healthy life, regardless of how much they have in their pockets. We all know the expensive cost of healthcare and how difficult it is to pay for medical expenses. As a community, it is vital that we should help the less fortunate of our community, the homeless, through the ability of healthcare. In our speech, we will discuss the different reasons why individuals become homeless, provide insight of their realities, and ignite the significant need of this policy to our society. We will also present visualizations of both positive and negative impacts, and lastly, our presentation will conclude with a call of action that we hope will one day come alive.
Here are some examples as to why we need to put in place a healthcare system for the homeless, including the big population of the homeless and the poor healthcare they're getting right now. While the population of homeless is getting bigger and bigger, a lot of them become homeless for a lot more complicated reasons. According to the U.S. Department of Health and Human Services, homelessness is defined as the following. A homeless individual is an individual whose primary residence during the night is a supervised public or private facility that provides temporary living accommodations, and an individual who is a resident in transitional housing. Researchers from the Federal Department of Housing and Urban Development found that California has 21% of the country's homeless population, or almost 116,000 people. When we go to San Francisco and Oakland, we can see homeless people all over the place. And our hasty generalization for them is usually they're addicts, they're crazy, they're lazy, and they don't want to work. However, unlike what we think homeless people are, the homeless population in California consists of different groups of people, and their backgrounds are so various that we cannot apply our hasty generalization on them and say they don't deserve health care. In the United States, the homeless population mainly consists of the following: homeless veterans, homeless youth, homeless families, and the others. They become homeless for a lot of different reasons. Veterans, serving our country, fighting the enemies, coming back with Purple Hearts. Those veterans devoted the best years of their lives to defending our country. However, a lot of them become homeless after their services. There were an estimated 57,849 homeless veterans in the States during 2013, which is 12% of the homeless population. The main reasons why they become homeless includes severe physical injuries, mental illness after combat, and family breakdowns, which gives them health damages. Youth, young, rebellious, vulnerable. California is one of the states that has the highest number of unaccompanied homeless youth, comprising 58% of the homeless population. The main group is college youth. The homeless college youth accounts for over 1 million of the young homeless population. Sometimes they have no choice but to get out of the house because they're above 18. They're homeless, rebellious, and vulnerable, and there are lack of abilities to get health care. Homeless families, children, bills, immigrant parents. The 2000s saw a new population of those experiencing homelessness, immigrant parent families. While those immigrant parent families try hard to come to the States to give their children a better environment, many of them don't have identities and they have to get jobs. As a result, a lot of immigrant parents cannot handle this complicated situation, which leads to homelessness at the end. With limited abilities, those families can hardly get health care.
All right, so being able to provide health care would help solve a countless number of problems that we have currently in the system. One of the main reasons that healthcare would help this population would be rehabilitation. As my colleague has talked about, there are some homeless that are addicted to alcohol, drugs, or suffer from PTSD coming back from work, which is post-traumatic stress disorder. Because of these disorders, they have no way to go back into society as a normal individual. They have to combat these diseases, these mental diseases, in their own form, and since they don't have healthcare for rehabilitation, it's even harder for them to do so. As written in a journal article, Neurocognitive Impairment in a large sample of homeless adults with mental illness, the prevalent rates of mental illness among homeless individuals are also much higher than those in community samples. Recent research has identified pooled estimates and prevalence rates of 12.7% for severe mental illness, such as psychotic disorders, and 11.4% for mood disorders, such as major depression among homeless seniors. This is an example of what kind of disorders these homeless individuals face at the moment. Another main issue that they have to face would be diseases and sickness. Because they are not in an insulated home, they face the trials of weather. They live on the streets and do not have protection from the cold or the rain. Because of this, they are a lot more likely to become sick and are able to contract a lot more diseases because of this. They also face horrible sanitary conditions, as anyone here has probably seen when they come to a major city such as San Francisco or New York. The streets are not the cleanest, and we've all most likely seen a tent or something on the side of the road, and you just see either garbage everywhere, maybe you see a rodent or birds or something on the street as well. As Rebecca Brown, MD Assistant Professor of Medicine in the University of San Francisco, was quoted in the online article, "Homeless Getting Older at Younger Ages than Their Peers," written by Liz Seeger. Usually we think of geriatric conditions as affecting much older adults in their 70s, 80s, and 90s. We found these conditions very common in homeless adults with the average age of just 58. Some of these diseases include dementia, arthritis, Parkinson's, heart disease, and high blood pressure. Because of these diseases, their life expectancy has also decreased drastically. The average life expectancy for a homeless individual is around 50 years of age, and for a regular adult in the United States, it is around 79 years of age. There are some people that say that why can't they just get jobs and reaping the benefits from Medicare or so on from said jobs. A lot of these jobs do not want to hire homeless individuals, however. As we've all seen on the streets, we usually see a homeless individual, they're not the cleanest, their beards are outgrown, their hair might be dreaded, and a lot of companies do not want these individuals representing the company because they want a clear-shaven, clear-cut individual to present them to their customers so they become a lot better than their competitors. They also face the stereotypes of addiction and that they have addiction to their lazy. Because of these stereotypes, a lot of companies do not want to hire them. They think that they will use said money to destroy their lives again, or that they will maybe be good one day and then the rest they'll just slack off and not care. In order to combat these negative effects, we want to introduce our proposition, Healthcare for Homeless People, or HHP.
So our policy recognizes the link between humanity and providing the essential availability of healthcare to aid people experiencing homelessness. Homelessness and health concerns often go hand in hand. According to the Department of Housing and Urban Development, compared to the general population, people living in shelters are more than twice as likely to have a disability. Thus, the urgency for effective healthcare solutions is essential. Our program, Healthcare for Homeless People, also known as HHP, would provide a cost-effective solution to the homeless as well as for those suffering from severe physical and mental health, along with substance abuse challenges. The cost of action for our program is that it's going to be regulated through Medicaid. As we know, the Medicaid and Medicare programs work together to provide medical coverage for the elderly and poor people. Medicare is the primary medical coverage provider for anyone aged 65 and older and those with disability, such that eligibility has nothing to do with income level. On the other hand, Medicaid supports low-income individuals and families by covering costs associated with medical and long-term custodial care, such that any eligibility for Medicaid is need-based, and the program has strict income eligibility requirements that vary from state to state. However, unlike Medicare that is partially funded through the people's payroll taxes, According to the National Alliance to End Homelessness, advocates for homeless people can support and strengthen mainstream healthcare by pressing for our program. It is no mystery that system change is a shared responsibility. Therefore, by introducing HHP, we can bring healthcare to the vulnerable members of our society. I know if I were in that situation, I would want someone to help me too. So why not start now?
There are many benefits for homeless people and our society if they are given the health care. First of all, if homeless people can get health care, the death rate of them will be decreased. According to the Russell's article, professional issue, homeless health care raising the standard. Homeless people is associated with the early death, with their average age at death of a homeless man constantly reported in the range of 40 to 47 years. Tragically, homeless people still die of treatable medical conditions. Homelessness is also associated with ill health, as both a causative and a causal factor. Therefore, when homeless people get health care, they can recover from many physical diseases and so on. Second, if homeless people can get health care, they are more likely to get a job. According to the website, Critical Medicine Employment and Homelessness, mental or physical illnesses also play vital roles in the employment participation of homeless individuals or those at risk for becoming homeless. Research illustrates that a disability, mental or physical, can result in difficulty of acquiring work. So, when homeless people can get a good body composition and normal mental conditions, their chances of getting a job can be more and more. Last but not the least, if the homeless people can get health care, there will be less HIV infections in our society. According to Clark's article, access to healthcare services for people living with HIV experience homelessness. People living with HIV who are homeless or at risk of homelessness experiences significantly worse health outcomes than those in stable housing. In addition, they are more likely to be diagnosed late, use substances, engage in high-risk sexual activities, and have difficulty adhering to treatment. Therefore, when homeless people get the treatment and no more knowledge about HIV from their health care, there will be less possibility for them to get HIV infections. Now it's Jessica's turn to talk about the negative.
So in the negative part is that, according to the article, how positive is their future, the homeless people are going through mental problems in their lives, which is not positive. These situations happen to be opportunities of mental illness such as depression, anxiety, and many other negative outcomes. Even though these are common illness in everyone's lives, but to the homeless, they are dealing way more than we ever know. In an article, Homelessness as a Psychological Trauma, the homeless people are dealing with many traumas in their lives. These traumas have potential risk factors. In this case, women are dealing with risk factors such as being abused by other people, and both men and women deal with psychological trauma that can make them believe in false beliefs, which is not a healthy situation in their lives. In the meantime, they actually do not receive medical care at this point because they're dealing with many of these negative symptoms. And lastly, in the article, homeless children, these homeless children are also going through a lot in their difficult times in their lives. These difficult challenges are very hard for them too, especially as children. These children can deal with trauma, and these traumas could affect their lives even as adults. Children are also feeling neglectful from their families because their families are trying to help them survive in a way. And through these difficult times with their families, children are also going through malnutrition, which that case, they are not having the right nutrition, the type of food that they need, and the drinks that, the water, or like water that they need for their health. In the meantime, their lives are at risk, and their future is beyond negative, and hopefully there will be positive. In many cases, there are millions of children that are having these risk factors, and they are suffering through them.
In our proposed policy, we are providing the availability of healthcare to individuals who are homeless. To grant healthcare to these individuals who is defined as homeless are worthy of a life, where their worries of health insurance do not contribute to the existent challenges of their lives. In hopes that our community sees the significance of human rights within this policy. To protect our homeless brothers and sisters, we ask you to get involved. While federal and state governments wrestle with decisions necessary to implement the Medicaid for the homeless, you can still make a difference by educating the homeless individuals about resources that are available to them. There are several organizations that specializes in the well-being of the homeless, such as Alameda Social Services that provides housing and small cash allowances. Everyone Home that advocates and tends to homeless individuals, and acgov.org that provides public assistance to the homeless, which are all located here in the Alameda County. Through the help of these organizations, you can make a difference in someone's life by simply visiting a website or making a call. First, you can visit the websites of these organizations to gain further knowledge about their vision, which can be found in the flyers along with their contact information. Furthermore, as you widen your knowledge about their causes, you can utilize their website to find ways to get involved. For example, in Everyone Home, you can become a member or join a committee, sign up to receive updates or an action alerts via email, or donate through their website. Everyonehome.org. Moreover, you can use their hotline 211, which is a free confidential 3-digit phone number that provides easy access to housing, critical health, and human services information. You can also contact Alameda County Director Chris Bazar through 510-670-5333 or visit his office located at 224 Winton Avenue, Hayward, California, to propose ideas to improve the quality of life homeless individuals face. In order to further our solution, we encourage homeless individuals to visit these organizations and learn what is accessible to them. The first step is to determine their qualification to Medicaid, which can be possible through a six questionnaire on medicaid/help.org, or visit ehelpmedicare.com, which provides a step-by-step process on how to complete a Medicaid application. Through these websites, resources, we hope that it is a step forward to a world where equal health can be offered to all people. We hope that in the near future, individuals who lay on the cold hard pavement of the streets should no longer face the reality of healthcare as a luxury. Instead, live the reality where healthcare is a part of their basic human right. And our goal is that this is them now,